The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice.
Hello, this is Karen Nickel, family nurse practitioner, and you are listening to Itchy and Bitchy, a podcast that provides answers to your many unanswered health questions. Over the years, women in menopause have asked me to share with them the best option to replace estradiol, the form of estrogen that is normally secreted by our ovaries. Which is better, oral or topical estradiol? Since this conversation keeps popping up, I'm going to share with you why a topical form of estradiol might be your best choice. Topical, also known as transdermal estradiol, may have advantages over oral estradiol because by using a topical form, first-pass metabolism through the liver is avoided, which can lead to a lower risk of blood clots, lower risk of gallstones, and stroke. Transdermal methods can also lead to a more stable hormone level and a lower risk of side effects like weight gain and breast tenderness. However, oral estradiol may be more effective for some women in relieving menopausal symptoms. Let me first explain what is meant by first-pass metabolism. When drugs are taken orally by mouth, they must first pass through the stomach, intestines, and then the liver before the drug reaches the bloodstream and finally reaches the target tissues. As a result, much of the drug dose has been reduced in this process, which decreases the amount of drug you're actually getting, as well as decreasing the drug's effects. The first pass effect can be bypassed by using topical forms of medications. Transdermal meds are first released from whichever form is being used, for instance, a patch, gel, or cream, and then dissolves on the skin's surface. The drug then enters a specific layer of the skin, then goes through the deeper layers of the epidermis. Once it has reached the dermal layer, the med is absorbed into the capillaries, the little tiny blood vessels in the area where the med was applied, and from there, it travels to the systemic bloodstream. So the drug goes straight from the skin to the blood rather than passing through the stomach and intestines, then liver first. Forms of topical estradiol include patches, creams, gels, and vaginal suppositories or rings. I'll discuss those options in detail a little later. So what are the advantages of using topical estradiol? Well, by bypassing the liver, topical estradiol avoids the first-pass metabolism associated with oral pills, which can increase the risk of blood clots and stroke. When we take oral estradiol, the liver makes more fibrinogen as the estradiol passes through the liver. Elevated fibrinogen levels increase our risk for clot formation. Stepping away from discussing estradiol for a moment, studies have shown that bioidentical progesterone in either topical or oral form does not increase fibrinogen, and some studies have shown that it actually decreases fibrinogen levels. On the other hand, oral progestins used in oral contraceptives and some HRT is a synthetic form of our natural progesterone, and in that form, it can increase clot risk. Very different things, progesterone and progestins. Topical estradiol may also have a lower incidence of gallstone formation compared to oral forms. Oral estradiol increases gallstone risk by increasing the amount of cholesterol in the bile, which makes the bile more sludgy and prone to gallstone formation. Additionally, oral estradiol can decrease the ability for the gallbladder to empty properly, which not only can cause the symptoms like pain and nausea, but also allows the bile to become thicker and form stones. Yet another advantage, Topical patches, creams, and gels may require lower doses and can provide a more steady release than oral estradiol, which may reduce side effects like mood swings and breast tenderness when taking HRT. We have to use higher doses of oral estradiol than topical because, as I mentioned earlier, there is more breakdown of the medication before it reaches the bloodstream when it goes through the liver first. The first-pass metabolism process can also lead to peaks and valleys of estradiol levels in the blood. Estradiol in a topical form is less likely to increase liver proteins like sex hormone-binding globulin. Sex hormone-binding globulin does just what it says. It's a protein that binds to our female hormones, and when hormones are bound to protein, our body cannot use them. We don't want them bound to protein. Since the amount of creams or gels that are applied to the skin can be easily adjusted, they allow more flexible dosing to suit individual needs. I've just listed several benefits of using topical estradiol, but oral estradiol also has some advantages. Some studies have found oral estradiol to be as or sometimes more effective than transdermal methods for relieving menopausal symptoms. Also, some evidence suggests that for certain individuals without risk factors, oral estradiol might offer greater protection against cardiovascular disease and hypertension than transdermal estradiol. There are a couple other things to consider about transdermal forms of estradiol. Patches can cause skin irritation or sensitivity, and when using estradiol in the form of gels, creams, or sprays, the hormone can be transferred to someone else with skin-to-skin contact within 6 hours after application. Hormone transfer can be easily avoided by washing your hands immediately after application and wearing clothing over the area of application. Estradiol patches will stay on with showering and swimming, but creams, gels, and sprays should not be applied immediately before showering or swimming, or the estradiol will go bye-bye. After this quick break, I will review the topical estradiol options that we have, so stay with me. Okay, so what are our options? Let's start with estradiol patches. There are a couple of types of patches available. One is a patch that you change twice weekly, and the other is changed once weekly. The advantage of the twice weekly patch is that it is significantly smaller than the once weekly patch, which is about the size of your palm. And the lowest dose of the twice weekly patch is smaller than a postage stamp. I sort of joke that once weekly patch is about the size of a coaster. It's a little bit smaller than that, but you know. Both types of patches come in branded and generic forms. Climera is a branded example of the once-weekly patch, and Vivel Dot is a branded version of a twice-weekly patch. If you experience skin sensitivity with the patch, or you get tired of the adhesive left behind when using the patch, and you want something that's easier to use, you can consider a vaginal ring, which is inserted vaginally and kept in place for 90 days. Then you remove it and put in a new one. There are a couple types of vaginal rings. Let's start with S-string, which provides a low-dose delivery. S-string, which is spelled E-S-T-R-I-N-G, continuously releases a dose of about 7.5 micrograms of estradiol per 24 hours over 90 days, which is much lower than the dosage used for systemic hormone therapy, much, much lower. This option has minimal systemic exposure. During the 90 days of treatment that the S-string provides, the blood levels of estradiol remains very low at 10 or less. When first inserting the ring, it does raise the blood levels of estradiol to about 55 within a few hours, but the levels drop down to 10 within 2 to 3 days. This dose will not relieve systemic symptoms like hot flashes and night sweats. It is designed to address vaginal dryness only. Due to its minimal systemic absorption, estring has less impact on plasma-binding proteins such as sex hormone-binding globulin than oral hormone therapy. A higher dose estradiol-releasing vaginal ring is also available in a product called Femring, Femring. It releases 50 and 100 micrograms per day versus estring's 7.5 micrograms per day. Big difference. This vaginal ring raises daily blood concentration of estradiol to somewhere between 41 and 76. These levels are high enough to decrease the number and severity of hot flashes and night sweats, and those symptoms are usually much improved or gone by 1 to 2 weeks after starting Femring. Like estring, if you are using a vaginal ring, you can leave it in place during intercourse. I thought maybe you might want to know this, but if you or your partner do feel the ring, you can try adjusting its position. If it's still uncomfortable, you can remove it just for intercourse and reinsert it after intercourse. Let's move on to estradiol gels. Divigel is one brand of estradiol gel that can be applied in 5 different amounts to provide 5 different doses. When starting this med for the first time, you apply 1/4 gram to the skin once daily, and you can work your way up to 1¼ grams once daily if needed to control your symptoms. A gram of gel squirted into your palm is a dollop about the size of a quarter. The package instructions recommend applying the Divigel to the upper thigh, alternating thighs daily. Divigel is a clear, colorless gel which is odorless when dry, and it comes in single-use packets. Estradiol is another brand of estradiol gel and comes in 1 dose that is in a pump device, and you apply 1 pump a day to the skin. The manufacturer recommends applying this gel to the outer arm below the elbow. Elestrin is our 3rd branded estradiol gel available. It also comes in a pump device, and dosing is 1 pump once daily, but they recommend applying it to the upper arm. And if you're doing that, please use the outer part of your upper arm so that you do not have skin-to-skin contact between your inner arm and your breast. We don't want estrogen on the breasts. There is one estradiol capsule that is designed to be inserted into the vagina to address vaginal dryness. So it is a dissolvable capsule that is used topically. This product is called Imvexxy, Imvexxy. It's a teardrop-shaped capsule that you insert into the vagina using your fingers. No applicators are needed. It is dosed twice weekly after using it daily for 2 weeks. The manufactured estradiol creams we have, meaning those that are available with a prescription at your regular pharmacy, they're not compounded, are vaginal creams that, like Imvexxy, are inserted every day for 2 weeks when starting the med, then used twice weekly after that. Estrace cream is the branded name, but it is readily available in a generic form. Both Imvexxy and Estrace cream contain low doses of estradiol, so they just address vaginal dryness. They are not designed to relieve systemic low estrogen symptoms. The only way to get estradiol creams that are dosed to help systemic symptoms like hot flashes and night sweats is to have them compounded by a compounding pharmacy. A provider who is knowledgeable in prescribing compounded HRT is needed to use this option. Other compounded topical estradiol options for systemic use include sprays, oils, and vaginal suppositories or creams. If you are paying out of pocket, or if your insurance doesn't provide good coverage of the manufactured topical estradiol options I just reviewed with you, there is a website called hrtclub.com, where your provider can send prescriptions. They provide estradiol patches, gels, and creams, again with a prescription, at a fraction of what you would pay out of pocket or for a high-tier medication on your prescription insurance plan. For example, a month's supply of generic Estragel, which I talked about earlier, is only $20 and no insurance is involved. Today, I'm just talking about estradiol replacement, but remember that it is always important to balance your estradiol with a bioidentical progesterone. Just a reminder. There are many topical estradiol options out there, which is very good news. If you are interested in starting HRT or are already on HRT and want to consider a topical form of estradiol, please consult with a healthcare provider to determine the safest and most effective option for your specific situation. Thank you for listening. Wherever you listen to this podcast, please leave a review and rate the podcast. Your reviews and ratings matter. Also, make sure you follow the show so that it will be automatically downloaded. That matters too. I encourage you to visit our Facebook page, IMB Podcast, where you can give us a like and leave comments or questions for me. Our website is itchyandbitchy.com, where there are blogs with some of our subjects available for you to read. As always, thanks to Forrest Wenzel, my son, our producer, and composer of our theme music, and the person who does all the behind-the-scenes work to make this podcast possible. Thank you very much, Forrest. Forrest is in his second year of his master's degree in music composition at Peabody Music Conservatory and is living his best musical life. I'm so proud of him and happy for him. Remember that your health is in your hands.